the French Quarter. This is Eyewitness Morning News.
The outbreak of the measles that started at Disneyland back in December has everyone talking about vaccinations. This morning, Dr. Jeffery Coco from Touro Hospital is here to talk about the potentially vulnerable section of the population. We're talking about adults being extremely susceptible. And thank you so much, Dr. Coco, for coming in.
Good morning, Sally.
And as we were discussing in the commercial break, back in the day when I was growing up, measles was considered a rite of passage. Everyone got them because we didn't have the vaccination. But people may have forgotten about just how serious this illness can be.
Yes, in 1963 they started vaccinating this problem away, and by 2000 the state health departments all declared measles no longer an epidemic. And since that period of time we've seen very few cases, but now we're starting to see unvaccinated travelers from underdeveloped countries bring this virus back into our society.
What is the measles and what are the symptoms?
Well, measles is a very highly contagious viral syndrome. Most people are very aware of the rash. However, that's only part of it. Usually when you get infected, at about 10 to 12 days, you start having symptoms. These symptoms include coughing, sneezing, runny nose, lethargy. You can actually get pneumonia. In fact, 1 in 4 people who get the measles can have very serious complications. And many years ago, the death rate was about 4%, and now it's about 1/10 of that, but still, death is still a probability.
When the outbreak occurred in the Disneyland area of California and spread across the country, we are finding that more than half of these cases involve adults. Why are the adults coming down with this illness?
Well, people have dropped off the vaccination program partially because of the success, but partially because in 1998, an article was published out of the Lancet, which is a European journal, that showed an association between autism and this vaccine. But since that period of time, fortunately, this has been proven to be a fraudulent act. It's been withdrawn, and we have 2 really good scientific studies that has disproven, without a shadow of a doubt, that there's no autism that occurs from these vaccines.
Now, here, suppose you don't remember whether you were vaccinated or not. What do you say to adults out there? Should they go ahead and have another vaccination, or could that be dangerous?
Yes, the vaccination is perfectly safe and very highly effective. If you're not sure you've been vaccinated, call your doctor and get a vaccine. If you want to be tested, a very simple blood test can determine whether or not you have immunity.
And so if you get a vaccination and you've already had one, you don't have to worry that's going to harm you in any way. It's just going to give you added protection.
Absolutely. In fact, most people are supposed to get 2, one at about 12 to 15 months and one before you start school. And in Louisiana, that's actually a requirement before you enter school.
And what about those people, adults who have the measles? Are they immune?
Yes, once you have the measles, you're immune for life.
Now, what is the treatment for the measles?
Well, unfortunately, we do not have any antiviral drugs right now to treat this, but we do support the patient. Again, I mentioned that 1 in 4 people can have complications, and some of those complications can be quite severe, such as pneumonia or inner ear infections. Both of those can be potentially life-threatening.
And how is the virus spread?
Well, the virus is very highly contagious. About 4 days before you actually get the rash, you become contagious. And if one would sneeze in an indoor setting, you can actually precipitate viral particles that hang in the air for about 2 hours. If an unvaccinated person breathes in these viral particles, they have a 90% chance of getting the measles.
And this is particularly dangerous for pregnant women.
Yes, pregnant women are mildly immunocompromised to begin with, and when they get a disease such as this, the mortality rate is much higher.
And so immunization, and you have a motto for that?
Right. If there's any doubt, don't hesitate, vaccinate.
All right. Well, thank you very much, Dr. Coco, for joining us from Touro.
Thank you, Sally.